Good morning. Today, our team, including myself, Steven Ngai from the Chinese University of Hong Kong, and Professor Chau-kiu Cheung from the City University of Hong Kong. So we are going to share with you our research on career interventions and non-engaged young people. So let me first of all share our PowerPoint with you. So our presentation will focus on the impact of career intervention on career competence and social well-being among non-engaged young people in Hong Kong. We would like to first of all make an acknowledgement. So our study was from part of a larger evaluation study of the Club of Daisy project, created and funded by the Hong Kong Jockey Club Charity Trust. And this conference presentation is adapted from a manuscript that has recently been published in Children and Youth Services Review.
Let me share with you about the background of our study. Worldwide, highly competitive job market and rapid job transformation has created fundamental change in the career journey of young people. So here we can see the linear transition from school to work are becoming diverse and individualized. And young people have to face a tortuous path in their school to work transitions, and they're more likely than adults to be unemployed. Coupled with the impact of the COVID-19 pandemic, we can see that this global recession and young people transition have become even more difficult. This is especially true for NEET youth, who may experience an increasing possibility of unstable employment, lower health status, and poverty, which create massive social costs. So in the context of Hong Kong, we are particularly interested in non-engaged youth, what we call the NEY. They're young people with unstable employment, inactivity, and a lack of ambition. Some examples of NEY include school dropout and unemployed youth and ethnic minority youth. So Hong Kong has a typical knowledge and service-based economy, which demands graduates to have strong work skills and participating in lifelong learning. So in our society, we can see that is an obvious mismatch of individual vocational skill and the demands of labor market. And this has resulted in social withdrawal, decline in occupational aspiration, low self-confidence, hopelessness, and passivity among young people, especially NEY. So for those NEY who manage to find some part-time jobs in the labor market, they are more likely to experience precarious, low-skilled work with limited opportunities for training and career progression. So that is an urgency to develop and implement services and intervention to help young people, especially NEY, back into education, employment, and training. So in our study, social well-being refers to one's individual evaluation of their social situation and functioning in society, encompassing numerous elements, including social contribution, young people's need for the benefit of society, social integration, young people's sense of belonging to a group or society, and civic engagement, young people participation in activities for the common good. With the characteristics of NEY that we just mentioned to you, this has created a host of disadvantages for and barriers to their social well-being. So providing NEY with career interventions to address their challenges in education and employment and encourage them to re-engage with society may be a promising approach. So we have conducted some rigorous literature review, and we have identified the relationship between career intervention, career competence, and social well-being. The first group of literature point to the relationship between career intervention and social well-being, such as offering young people exposure to the real world of work, so can strengthen their link with the rest of community and promote their civic engagement. And participating in workplace learning can also promote integration into the labor market and help them to build up relationships with others possessing similar interests. Another group of literature points to the relationship between career intervention and career competence, like career intervention can improve their self-awareness, access to career-related resources and information, and expose young people to a real world of work environment. So all of them point to the positive impact of career intervention for building career competence, which will present a strong sense of personal agency, emphasizing young people's active role in navigating their life journey, requires self-understanding and self-reflection, and also about the ability to engage in career-related activity and to plan and manage their education and career pathways. The final group of literature point to the relationship between career competence and social well-being, which also provide us with some clue about the mediating function of career competence. Like those with higher career competence, they're more likely to have higher civic engagement, positive social integration, to serve others and make contribution to society, and have closer connection with friends and family, and participate more in volunteer work. So in summary, we can see that while the literature points to the interrelationship among the three variables, we can see very few of the study, they investigate the three variable career interventions, well-being, and also career competence all together. So our aim is to examine the effect of career intervention on social well-being, as well as the mediating effect of career competence in the relationship between career interventions and social well-being. So in this study, we have particularly developed some tailor-made career intervention with our NGO partners. Our project refers to the Club at JC project. The aim is to empower NUI to become active navigators of and change agents of their career and life development pathways. So as I just mentioned to you, we have 6 career interventions. The first one is develop interest, awareness, and motivation. So DIAM, which allow young people to experiment, discover, and develop their interests. So at the end, build up their awareness and motivation for career development. Semi-structured learning, SL, refers to activities such as workshop and mentorship programs, which help to enrich young people's self-understanding and enhance their knowledge and multiple pathways and career management strategies. Career counseling, CC, refers to activities taking place at individual and group levels to help individuals to arrive at decision about their careers, and also to prepare individualized career and education plans. Learning through service and volunteering and caring, LSVC, provides young people with experiential learning experience and engage them in volunteer work in community service setting. So which has the function to strengthen young people's skills and connect them with relevant stakeholders. Workplace learning, WL, refers to various programs offering exposure to work and work-related experience, which are helpful to explore workplaces and to understand different careers and work ethics. Finally, facilitating pathway choice and implementation, FPCI, refers to activities including career talks and career expo, which help to support young people to pursue their goals by exploring different kinds of career and education pathways. So with the literature review, we have 2 hypotheses in our study. First, career intervention have a positive and direct effect on NUI social well-being. Second, career intervention have a positive effect on NUI social well-being via the positive mediation effect of career competence. So regarding our research method, our participants were NUIs in Hong Kong who face various disadvantages in their school-to-work transition and are at risk of becoming NET youth. So that is a total of 665 NUI participating in the Club at JC project. All of them are aged 13 to 39. We have 2 major data collection sources. One is from social workers responsible for helping NUI participants. So they filled in administrative record forms monthly to record the demographic information and also the frequency of career intervention of the young people. We also collect data directly from participating NUI 2 waves with an average interval of 4 months. So the 4th month period is based on the following rationale. So to support NUI, we need to move very fast. So providing intensive intervention within a short period of 4 months is really important. So this kind of consideration is also comparable with current international standards, such as those of the Youth Guarantee Scheme of the European Union. So here is the participant profile. We have more or less equal proportion of the gender. Most of the participants are Chinese, born in Hong Kong, with education level of senior secondary or below. Most of them are unemployed, and they experiencing different kind of disadvantage. Some of them even with multiple disadvantages. And the average age is 19.48 years. So now I'd like to pass the time to Professor Chau-kiu Cheung to share with you about the result in our discussion. Chau-kiu, please.
Okay. I'd like to continue the presentation about 3 parts. One is about measurement, another analysis, and lastly about something about discussions. So about the measurement, we adopt some internationally validated scales to measure the outcome variable. But for the input variable, we have some measurement about the interventions. So we have 6 interventions. So we get the data from the monthly record from the social worker or practitioners from month 0, month 1, month 2, and month 3, and month 4, and ask them about what happened in the last month. So we count as the intervention that lasts for 30 minutes or more, and then count the number about the 6 types of interventions. So next, so afterwards, we have to conduct some confirmation factor analysis about the 4 important outcome variables. So the first one is about the career development competency or career competence in participating in some developmental activities. So this is the important mediator in our structural model. And the second one is civic engagement. This is about something they can offer to the community. They can help the community and try to improve the community. And then the next measurement is about social contribution. That is, we ask them how much they contribute to the community and do something for the community during the past month. So the last one is social integration. We ask them how about they are accepted by their friends, or they could chat with their friends. So the next presentation, the 6th slide, that is, in order to have valid result in some regular ways, we followed the important criteria to identify our model so that they can be credible, they can be reliable and valid. That is, we adopt some common criteria for model fitting, and then we try to use the strata and as well as the M+ to perform the analysis. Okay, so the next. So it is the result from confirmatory factor analysis. That is, we try to confirm 4 important factors. So importantly, that we can notice that the factor loading are very outstanding, very high. So it is a very important demonstration about the convergent variety as well as the reliability of one of the mediating variable. This is a career development competence or competency. So the next slide would be composed of another 3 factors about some social outcome, including social integration, social contribution, and civic engagement. So as well, we also found that the factor loading appear to be very outstanding. So we have the result for the baseline measurement as well as the follow-up measurement during the 4th month of measurement. So this is the combination of our factor structure. So the next slide will be the core, will be the crux of our analysis. So apparently this is quite simple. So we can notice that in the left-hand side, there are the 6 interventions. And in the middle, this is a mediating variable. This is a career development competency. And the right-hand side would be the 3 social outcomes, social integration, social contribution, and civic engagement. So one thing that we observe clearly is that there is statistically significant effect of career development competency on the 3 social outcomes. That is, we notice that this is represented by the solid arrow, and on the other hand, we have some broken arrows indicating that the effect is not significant. So importantly, in this model, we already control the important background characteristics, including age, gender, education, and most importantly, we also include the baseline measurement, the baseline outcome as the control variable. So it means that we already checked the change due to the interventions on the outcome factors. So afterward, we would like to discuss the important findings. First of all, we found that hypothesis 1 get some support considering the positive and significant input from the surface learning activity. That is learning from surface and volunteering and caring. And this is one of the important interventions. We found out that this intervention can contribute to the social contribution as well as the civic engagement. But unfortunately, this intervention does not contribute to the career development competence. So we realize that just because this kind of surface learning will have the primary aim to promote social integration and social contribution. So, and this is what we can find. Okay, the next slide. So, moreover, we get some support for hypothesis 2. That is, first of all, we have some interventions that can contribute to the meditating process about the career development competency. And lastly, through this mediation, and then we can raise the outcome in the social integration and civic engagement. So, importantly, we found that 2 of the important interventions, including the workplace learning and semi-structured learning, will have the important input. So especially about the semi-structured learning, that is through mentorship, that is it can contribute directly to the social outcome. So we realize that the semi-structured learning would be a kind of stepping stone to enhance the young people engagement. Okay, the next slide. So at the same time, in the context, we also found out that 3 of our interventions, including interest development and career counseling, and then some career talk and expose about the career path, do not demonstrate significant impact on career development competency and some social outcome as well. So the important point we try to emphasize is that this is the competition, this is the context. We try to test all the interventions at the same time. So as a result, we found that 3 of them can have some input supporting our hypothesis, but 3 of them do not have the supporting result just because of this kind of issue. That is, the 3 interventions do not deal directly with the career learning and social contribution, etc. And then due to the poverty of the young people, and then this is the problem of the intervention. This is not about something about learning. That is the result that we can find. So maybe lastly is about our limitations. So of course, we cannot generalize the finding to all young people. We have the limitation that it is they are coming from Hong Kong and they are NEY, that is long-engaged youth, and the time is limited. Just we only checked the baseline and the 4th month follow-up, and then the measurement is also limited. We do not cover all the possible outcomes. So we also rely on self-report from the practitioner and the young people. So overall, that is the limitation. So at the same time, we do not so far conduct any subgroup analysis to elaborate some interesting finding. Okay, so this is the ending. So lastly, so this is the slide will show some reference of if you are interested, we can look at the reference. So this is the ending of the presentation. When for your patients, this is the time for your question and answers.